Hey everyone, welcome back. We're diving into something that's been all over the news lately, a surge in human metapneumovirus cases,
Mm.
or HMPV, especially among kids in China. You've probably seen some of the headlines online. Some are even saying this could be the start of another pandemic. So today,
Hmm.
we're going to cut through all the noise and figure out what's really going on and if we should actually be worried. We've got a bunch of articles from different sources, like the Jerusalem Post, Live Science, and the Economic Times,
Yeah.
all looking at this from different angles.
Yeah, it's definitely something to keep an eye on. But like always, let's stick to the facts. So HMPV is a respiratory virus, kind of similar to RSV. It usually causes those familiar cold-like symptoms, but it can be more serious for certain groups, like young kids, the elderly, and people with weaker immune systems. For them, it can lead to things like pneumonia.
Okay, so not something to just ignore that.
Yeah.
And the articles are painting a pretty intense picture of what's happening in China.
Right.
Overcrowded hospitals, a big increase in cases, especially in kids under 14. The Economic Times even mentioned a study from April of last year that found HMPV cases actually went up after the COVID-19 pandemic, even higher than before the pandemic. It's kind of weird.
Yeah, it is. One theory researchers are looking at is this idea of an immunity gap. Basically, all the lockdowns and social distancing we did during COVID might have messed with how HMPV normally spread. So now that we're all interacting more, there are more people who could be vulnerable.
So it's almost like we hit pause on being exposed to the virus for a while, and now it's trying to catch up. That makes sense. But it makes you think about the long-term effects of all the pandemic disruptions, doesn't it?
Totally. And that's something researchers are still trying to figure out, how the pandemic might have changed things for respiratory viruses in general.
Okay, so we're still learning about how all these viruses and events are connected. But here's what I'm finding kind of reassuring. Even though HMPV cases are up, it's not a new virus. It's been around since 2001. So it's not like we're dealing with something totally unknown.
Yeah, exactly. And while it's good to be cautious, we don't need to get swept up in all the fear-mongering. Both the Chinese government and the World Health Organization have said this is not a public health emergency.
Okay, that's good to hear. But that hasn't stopped other countries from getting a little nervous.
Right. The Jerusalem Post mentioned Cambodia, Taiwan, and Hong Kong are all on high alert. They're watching really closely to see what happens.
Well, that's exactly what they should be doing. That's what global health surveillance is all about. Staying ahead of things,
Yeah.
tracking how diseases spread so we can respond effectively. Yeah, that makes sense. Okay, so we've got this surge in China. Neighboring countries are on alert, but no global emergency yet. If you're enjoying our deep dives on the topics, please let us know. Give us it goes a long way to helping us create better content. And I know a lot of people are seeing these HMPV headlines and immediately thinking back to COVID. Are those comparisons fair?
Well, there are definitely some similarities. They're both respiratory illnesses. They spread in similar ways. Coughs, sneezes, close contact. And they can both hit vulnerable populations harder.
Okay, so the way they spread and some of the symptoms overlap.
Hmm.
But what about how serious they are? Are we talking about the same level of risk here?
That's where things differ a bit. While both HMPV and COVID can make people really sick, COVID has a wider range of severity. We've also seen those long-term complications with COVID, like long COVID, which we haven't really seen with HMPV. And of course, the big difference. We have effective vaccines for COVID, which have thankfully made the illness and deaths a lot less severe. We don't have that for HMPV yet.
Oh yeah, that's a huge factor. So no vaccine for HMPV. But what about treatments? Are there any specific antivirals available?
Not really, unfortunately. Right now, treatment is mostly about managing the symptoms, keeping people hydrated, controlling fever, and in serious cases, giving them oxygen support to help with breathing.
So it's all about prevention and supportive care for now. And speaking of prevention, all the articles really stress how important those basic hygiene practices are. The Economic Times even mentioned that the Indian National Center for Disease Control, they confirmed there are no HMPV cases in India.
Yeah.
But they still emphasize how important those preventative measures are.
Yeah, it's a good reminder that even without a vaccine, we can still do things to protect ourselves. Those simple things, like washing our hands often, avoiding close contact with people who are sick, covering our coughs and sneezes, they really do make a difference. Not just for HMPV, but for a whole bunch of respiratory infections.
Right, those are the things we can control, even when there's so much uncertainty around. So it sounds like the message is vigilance, not panic.
Exactly. We need to stay informed, take reasonable precautions, but also keep things in perspective.
Well said. Now, I'm curious about something. The articles mentioned a possible connection between the COVID pandemic and this recent HMPV surge. Is there anything to that? Or is that just speculation?
It's something researchers are definitely looking into, and there are some interesting theories. One idea is that because of all the lockdowns and social distancing during COVID, we might have accidentally created a kind of immunity gap when it comes to HMPV.
You mean, like we weren't exposed to it as much, so our immune systems aren't as ready to fight it off now?
Exactly. And that could explain why we're seeing this resurgence now, since a lot of those restrictions have been lifted.
That's pretty fascinating. Almost like a side effect of those necessary pandemic measures. Are there any other explanations they're considering?
Another possibility is that because healthcare systems were so overwhelmed during COVID, there might have been some HMPV cases that weren't reported. People might have been hesitant to go to the doctor for respiratory symptoms, maybe because they were afraid of catching COVID, or because hospitals were so busy.
So the actual number of cases during the pandemic might have been higher than we thought.
That's one hypothesis. But it's important to remember that these are still just theories. Researchers need more data and analysis to figure out if they're true.
Right, we can't jump to conclusions.
Yeah.
But those potential connections are definitely interesting to think about.
Definitely. It just shows how complex these interactions between viruses and global events can be.
Okay, so we got a lot to think about here. The surge in China, the global response, those possible links to the pandemic. But before we get overwhelmed, let's take a step back and focus on what matters most. How does all of this affect us locally?
That's the key question, and you've done some research on that.
Right, I have. And what I found is actually pretty reassuring. I talked to Dr. Local Healthcare Professional's name, a leading infectious disease specialist here in your city region, and according to them, while there's been an increase in respiratory illnesses overall this season, which is totally normal for this time of year, they haven't noticed a big spike in HMPV cases specifically.
Oh, that's good to hear. It's always a relief to know that things aren't as bad locally as the headlines might make it seem.
Exactly. And Dr. Local Healthcare Professional's name also assured me that our local healthcare system is ready to handle any potential surge in HMPV cases, just in case it happens. They have enough tests, treatment plans, and expertise to manage these situations effectively.
That's great to know. It shows how important it is to have a strong healthcare system and a proactive approach to public health.
Absolutely.
Yeah.
But even though things seem pretty stable here right now, Dr. Local Healthcare Professional's name did say that we shouldn't let our guard down completely.
Of course. Vigilance is key.
Yeah.
Especially with respiratory viruses.
Right. They reminded me about the importance of those preventative measures we've been talking about. Washing our hands often, covering coughs and sneezes, staying home when we're sick, and even considering wearing a mask in crowded indoor places, especially if we're not feeling well.
If you want to know whenever a new deep dive comes out, don't forget to hit the subscribe button. I've noticed that YouTube automatically keep recommending deep dives just because you liked. That's good advice. Simple, but powerful ways to prevent the spread of those respiratory infections, not just HMPV.
Absolutely. And talking to Dr. Local Healthcare Professional's name really made me realize how much we learned from COVID-19. We're much more aware of how important those basic hygiene practices are now, and we're better prepared to deal with new health threats.
I totally agree. It's been a tough few years, but we've gained valuable knowledge and experience that will help us in the future.
Well said. So while we should definitely keep an eye on the global situation with HMPV, things here locally seem to be under control for now. Our healthcare system is ready, and we can all do our part to stay healthy by practicing good hygiene and staying informed.
That's a great point. It really feels like we've all become amateur epidemiologists over the past few years.
Yeah, it does. But it's good to know those lessons are helping us deal with these new challenges. So
Yeah.
I want to go back to something we mentioned earlier. The fact that there's no vaccine for HMPV. Prevention and symptom management are super important. But having a vaccine would be a game changer, wouldn't it?
Absolutely. A vaccine can make a huge difference in reducing the impact of HMPV, especially for those vulnerable groups we've been talking about.
So are there any groups working on developing one? I mean,
Yeah.
we saw how quickly scientists came together to create the COVID vaccines. Is there the same kind of urgency around HMPV?
Yeah, there are definitely research teams all over the world working on an HMPV vaccine, and they've made some promising progress. But we have to remember that developing a vaccine is a really complex process. It takes time, resources, and a lot of careful research to make sure it's safe and effective.
Okay, so it's not as simple as just snapping our fingers and having a vaccine ready to go. What are some of the challenges specific to developing an HMPV vaccine?
Well, one challenge is that HMPV is kind of a shapeshifter. It has a lot of different strains that are circulating, which makes it hard to develop a vaccine that protects against all of them. And then there's the question of immune response. We need to make sure the vaccine triggers a strong and long-lasting immune response, especially in young kids and older adults who are the most vulnerable to getting really sick from HMPV.
So it's kind of a scientific puzzle,
Mhm.
figuring out how to target those specific strains and get the right immune response.
Exactly. And then there's the issue of funding. Developing a vaccine is really expensive, and it needs a lot of investment from governments, research institutions, and pharmaceutical companies.
It makes you realize how much effort went into developing those COVID vaccines.
Totally. And while it's frustrating that we don't have an HMPV vaccine yet, the things we learned from developing the COVID vaccines are definitely helping with the HMPV research.
That's good to hear. So while we wait for a vaccine, what are the most important things people can do to protect themselves and their families from HMPV?
Well, like we've talked about, those basic hygiene practices are essential. Washing hands frequently, covering coughs and sneezes,
Mhm.
avoiding close contact with people who are sick. Those are all really important. And it's always a good idea to talk to your doctor if you have any concerns, especially if you or someone in your family is more vulnerable to getting sick.
That's great advice. It's all about being proactive and staying informed.
Right,
Yeah.
exactly. And the more we learn about HMPV, the better we'll be able to prevent and manage it.
Well said. Now I want to talk about something else that's been on my mind. We've talked a lot about how HMPV and COVID-19 are similar, but there's one aspect I think we should talk more about, the potential long-term effects. We know that long COVID has been a big concern, but is there any evidence that HMPV can have similar long-term consequences?
That's a really important question, and
Oh, yeah.
we definitely need more research on this. We haven't seen the same kind of widespread, long-lasting symptoms with HMPV like we have with long COVID, but there have been some studies that suggest that getting infected with HMPV could increase the risk of developing certain respiratory problems later in life, like asthma or
Yeah.
COPD.
So even though HMPV usually causes a mild illness that doesn't last long, there could be some subtle long-term effects that we're just starting to understand.
That's a possibility, and it shows that we need to keep researching the full range of HMPV's effects.
It's like we're always uncovering new layers of understanding. Just when we think we know a virus, there's always more to learn.
Exactly. That's what makes science so interesting. It's a constant process of discovery and getting closer to the truth.
Okay, so for our listeners,
Yeah.
what's the main takeaway here about these potential long-term effects?
I think the main message is that even though HMTV is usually considered a mild illness, we shouldn't take it lightly. We need to be aware that there could be long-term consequences, even if they're not as common or as serious as what we've seen with COVID-19.
It's a reminder that every virus,
Yeah.
Even one that seems pretty harmless
Mhm.
can have its own unique set of challenges.
Exactly. And as we gather more data and learn more about HMPV, we'll get a better understanding of its long-term effects.
Well said. Now, before we wrap up this deep dive, I want to take a moment to think about something that's been coming up throughout our conversation. The fact that global health is all connected. This surge in HMPV cases in China. It reminds us that what happens in one part of the world can have an impact everywhere else.
It's a powerful reminder that we're all connected when it comes to health and well-being. And it shows how important it is to work together globally, to keep track of diseases and be prepared to deal with them.
Absolutely. We need to be proactive, share information, and support each other in facing these challenges together.
I couldn't agree more. Global health is a responsibility we all share.
Well said. So we've covered a lot in this deep dive. We talked about the surge in HMPV cases, the similarities and differences with COVID-19, the challenges of developing a vaccine, the importance of preventative measures, and the potential long-term effects of this virus. But as we wrap up, I want to leave our listeners with a sense of empowerment, not fear.
That's a great goal. Knowledge is power. And the more we understand about HMPV, the better we can protect ourselves and our communities.
Exactly. So let's go over some of the key takeaways from our discussion.
Yeah, that sounds good. Let's break it down.
First, HMPV is a common respiratory virus that can cause a range of symptoms, from mild to severe. It's especially important to be careful when it comes to young kids, the elderly, and people with weaker immune systems, because they're more likely to have complications.
Right. And even though we don't have a vaccine for HMPV right now, we can still do things to protect ourselves and others by following those tried and true preventative measures, washing our hands frequently, covering coughs and sneezes, and avoiding close contact with sick people.
Exactly. Those simple things can make a big difference. We also talked about the research that's being done on HMPV, including efforts to develop a vaccine and to better understand the potential long-term effects of the virus.
And those research efforts are really important. The more we learn about HMPV, the better we'll be at preventing and managing it.
Well put. So, while we should definitely keep an eye on what's happening with HMPV globally, the situation here locally seems to be under control for now. Our healthcare system is ready, and we can all do our part to stay healthy by practicing good hygiene, staying informed, and talking to our trusted healthcare providers.
Absolutely. Keep learning, keep exploring, and keep asking questions. That's how we stay ahead of the game when it comes to our health and well-being.
It really is amazing to see how everything's connected on a global level. But it's easy to get caught up in the big picture and forget about what's happening right here in our own backyard. So I want to bring things back down to earth for a minute and focus on what this HMPV surge means for us locally.
Yeah, that's a good point. It's important to talk about these international outbreaks and global trends, but ultimately, it's what's happening in our own communities that affects us the most.
Exactly. So I did some digging.
Yeah.
And I reached out to a few local healthcare professionals to get their perspective. And you know what? They're actually not seeing a big surge in HMPV cases here yet.
Oh, that's good to know. It seems like those global trends aren't really translating into a local crisis right now.
Right. And all the healthcare providers I talked to emphasized that our local hospitals and clinics are prepared to handle any potential increase in HMPV cases. They've got the testing, the treatment plans, and the experience to manage these kinds of respiratory illnesses effectively.
That's great to hear. It speaks to the strength of our local healthcare system. We're ready, even if things do change.
Absolutely. But even though things seem pretty stable here for now, the message I kept hearing from these healthcare professionals was vigilance, not panic.
Right. It's a good reminder for all of us. Stay informed, be aware, but don't freak out.
Exactly. They really stress how important those preventative measures are. You know, washing our hands, covering our coughs, staying home when we're sick. Those simple things can really make a difference in stopping the spread of respiratory viruses, not just HMPV.
Totally. It's like we have this toolkit we can use even without a vaccine. We can take steps to protect ourselves and the people around us.
And, you know, talking to these local healthcare professionals really made me realize how important it is to have a reliable source of information, whether it's your doctor, a local clinic, or even a podcast like ours. Having access to accurate information is crucial, especially when things are uncertain.
Absolutely. With so much information out there, it's more important than ever to be careful about what we believe.
Well said. So to sum up this deep dive, I think the takeaway message is this. While we should definitely keep an eye on the global HMPV situation, the situation here locally seems to be under control for now. Our healthcare system is prepared, and we can all play a role in staying healthy by practicing good hygiene, staying informed, and talking to our doctors or other healthcare providers if we have any questions.
That's a great summary, and I think it goes back to a theme we've been talking about, the power of knowledge. The more we understand about HMPV, the better decisions we can make about our own health and the health of our communities.
Exactly. So keep learning, keep exploring, and keep asking questions. Thanks for joining us on this deep dive, and we'll see you next time.